Good morning, everyone. Good day, good evening, wherever you are in the world listening to us today. My name is Ben Blanquera, and welcome to CDO Magazine. I'm with Rackspace Technology, a leading provider of hybrid cloud and AI services for firms in the data analytics and AI modernization journey. This year, we're speaking to leaders across the globe, talk about their experiences with AI with Dr. Dominik Nowak, President of the Ontario Medical Association. Welcome, Dominic.
It's such a pleasure to be here with you, Ben.
You think about this auto scribe and then you think about this auto referral. Um, is this going to be like next 3 year kind of thing, or do you think it's going to be 10 years? I'm just curious, like, what's the pace of this change going to be?
Yeah, look, it couldn't come soon enough. And there is a work already in terms of
Hmm.
building out and spreading AI Scribe that's
Hmm.
coming up in the next few months, and
Okay.
advocacy work that we're already doing behind the scenes.
Yeah.
If you asked me a year ago, again, it would be maybe a handful of doctors per community that are using
Hmm.
AI Scribe technology. Now it's already one or two in 10 in Ontario that we're seeing, and it's
Yeah.
going to continue to grow. And what we need are, what are those supports that people who are, wondering about it, curious, willing to try, but haven't yet tried it. And then what are those supports that doctors need to make sure that these systems are continually improving patient care as the technology gets better?
So I'm just curious if you could wave a magic wand and you had three magic wishes, Dominic, to accelerate this. What would you wish for?
Yeah, I Number one, let's make sure that it's in every practice and being used by every doc in a way that offloads the administrative burden for them. And
Mhm.
look, the studies that we have already say that AI scribe technologies save 4 hours per week on average for a regular practice. That's half a day. Plus, our doctors
Mm.
are saying that it saves them a lot of weekend time
Oh
as
my
well. Some of
goodness.
them are reporting that they're saving essentially a day per week in
Hmm.
documentation burden and the administrative burden. So number one, let's get this into
Hmm.
the offices of docs so that it can improve care. Number two, let's make sure that the solutions we have today aren't just good for today, they're building out that capacity for tomorrow. I think of how much this technology has already improved and changed in the last year alone, and that scale of change is accelerating. So let's say in 5 years, we don't want to be stuck with today's technology. We want to make sure that the technology keeps on getting better. And
Yeah.
then my third wish is that these solutions are co-designed with doctors and co-designed
Mm.
with patients, the people that are going to be benefiting from the technology, right? And some of the best tech and AI ideas I've seen have been in teams that have really talented, smart, cutting edge technology and business people, but then also innovative doctors and co-design with patients on teams together, working together to make sure that that technology lands not just in a business sense, but also in a clinical sense.
That is such an insightful comment. As we design these solutions, for all the solution providers out there, let's make sure we do it with the docs and the patient. So it is a holistic point of view, and you're actually improving the experience versus layering on just another
Exactly.
technology, right?
Yeah, and I'll point to what happened with electronic medical records as one example.
Okay.
Uh, a caution story, right? When we originally had electronic medical records coming up to replace paper notes, uh, folks were very excited. But then right now, if you ask many doctors in Ontario and Canada, they'd say that electronic medical records actually add a lot of administrative burden, that there's a lot of inefficiency, that there's the technology is years, if not decades, out of date for many electronic medical records. So we want to make sure that the opportunity we see with AI, in particular some of these early wins like AI Scribe, are
Hmm.
continually being co-designed with doctors. They're actually improving patient care, not adding to the bureaucracy,
Hmm.
and that they're keeping up to date with where the technology is, rather than a situation where we end up with, out of date technology like we might have in with many electronic medical records.
That is fascinating. As I talk to different industry peers, what we're seeing, Dominic, is sort of there's this new type of team that is around creating AI products that starts with customer experience.
Yeah.
Like what does, and design for experience is a key part of that. And then you have the data, then you have the analytics, then you have the engineering. And that's really, that's refreshing now that we're seeing the industry recognizing that you have to start out with the customer experience.
Yeah, exactly. And you can think of who's the actual customer for
Hmm.
AI technology in healthcare. Obviously, you want the patient to be at the center and to be beneficiary of
Hmm.
whatever technology you use. You have the doctors and health professionals that are hopefully being benefited from it in terms of decreased administrative burden, being able to focus on what actually matters during the visit. I also think of the bigger picture customers, like maybe public health is a
Hmm.
beneficiary of some of
Yeah.
the technology that we have, even on a clinical level, that so that we're able to see that bird's eye view of a community's health. Maybe there are connection points between
Hmm.
health and social services from the
Oh my goodness.
technology that we have, and bridging that
Hmm.
divide between healthcare and the rest of society and social services in terms of how we support people. All those different lenses could be really important in terms of how we co-design the technologies that we have.
I love that. I love ending with this notion. Let's co-design these
Yeah.
technologies, and I love. I'm going to walk away, Dominic, with this notion of like it's about joy and health.
Yeah,
So
exactly.
thank you.
So if there's one thing that is
Hmm.
the biggest benefit from AI in healthcare that I'd encourage everyone thinking about this to look at is joy in work, right? Right now we have a situation where health professionals, I'd say across the world, but including in Ontario and in my home communities, they're feeling stretched. They're feeling
Hmm.
a lot of pressure from a healthcare system that's in crisis in many communities. And how do we restore joy in work in healthcare? How do we make it so that we remove the pebbles in people's shoes as our health professionals are doing the important work that they do? And how do we make it so that they can focus on what they train to do, what they find joyful, and what they find professionally meaningful in terms of caring for patients, which is going to be the patient care that they signed up to do.
Absolutely. I love this, Dominic. Your peers made a wide choice in electing you president.
Thank you.
I can see the passion, but also it's what's at the meta level. What's the most important things we're trying to do?
Yeah, thank you.
And so we appreciate you being on here, Dominic. Any last words for the audience, Dominic?
Yeah, look, I'd say that let's make sure that the technology is not just good for today, but also good for tomorrow. Let's make sure it's good for doctors and patients alike. And then finally, let's make sure that it's adding to joy in work. We have a situation again where that 19 hours weekly of unnecessary red tape and bureaucracy is taking us away from patient care and taking joy away from clinical work and medicine. Let's make sure that any technology we add adds to joy in work and makes medicine and healthcare fulfilling, just like it should be.
Love it, love it. We're gonna I'm gonna call you the joy guy, Dominic. I love it. Thank you so much, Dominic, for your time. I appreciate you being on here today.
Such a pleasure, Ben.